Hello. Today in my audience I have Suzette and Gustavo. Please take a seat while I do my presentation.
Yes, ma'am.
Just imagine for a moment having to breathe out of a straw. That's the life for a person that has cystic fibrosis. Cystic fibrosis is an inherited chronic disease that affects 1 out of 3,000 individuals. Before today, did you know anything about cystic fibrosis? Probably not, because the first time that I heard about cystic fibrosis was about a month ago when my baby boy was diagnosed. Since then, I've been exposed to many aspects of the disease. Knowledge is power, and it won't hurt to learn a little bit more about the disease. Today, I'm going to talk to you about the disorder, the treatment, and the long term effects of cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is a common life-threatening disease that damages the lungs and the digestive system. Symptoms of cystic fibrosis are broad, even in mild individuals. Individuals with cystic fibrosis produce a sticky mucus that gets stuck along the lungs and the pancreas and other organs. The mucus clogs up the airway and the bacteria, leading to infections and lung damage. If you have cystic fibrosis, you most likely will have salty skin, persistent cough with phlegm, shortness of breath, difficulty with bowel movements. One thing to understand about cystic fibrosis is that not everyone diagnosed with the disorder has the same symptoms. Now you're probably wondering, how are you diagnosed? Cystic fibrosis is a genetic disease, meaning you must inherit a gene from each parent to get the disease. Both parents must at least have one defective gene. If you do have cystic fibrosis, they will follow up with you with a sweat test. A sweat test is basically detecting the salty chemicals in the individual's individual's body. A person with cystic fibrosis have 2 to 5 times more salty chemicals. Now that you know the symptoms, what is the treatment for this disease? Treatment really depends on what kind of cystic fibrosis you have. Remember, I said not every individual has the same type of cystic fibrosis. So some of the treatments that a person with cystic fibrosis could have is airway technique. This treatment basically focuses on the lungs and the airway, making sure that it's clear and helping them not deteriorate and have lung damage. Aerosol therapy is another treatment. This treatment is basically inhale medication, kind of like people with asthma. Another treatment is for patients of cystic fibrosis that are very severe, probably needing like a lung transplant. Along with treatments, there comes long-term effects. Cystic fibrosis has long-term effects that affects the digestive system, the respiratory system, the lung system, the reproductive system, and other organs. Besides the damages on organs, it takes a toll emotional state for the family. The diagnosis of cystic fibrosis significantly affects the routine of the entire family. Everything changes once someone's diagnosed. As the ill person, you never know when they have to be hospitalized. You're constantly in and out of the hospital. And you also have to worry about the pain of living with the possibility of death. Cystic fibrosis has been transformed now in the 20th century from what used to be a fatal illness into a chronic illness. As you see, cystic fibrosis is a chronic disease and we should make awareness. Many people are not aware of this disorder like me. I never knew about it until my son was diagnosed. Therefore, as we discuss what the disorder is, the treatment, and the long-term effects, you are now well prepared to tell other people and make them aware of the disease. Thank you for watching.